Well, actually, thank you for the invitation and dear colleagues and participants of Second Mestro to present our work of the integration of artificial intelligence in the radiation oncology, especially for the treatment of liver cancers. Actually, I was in Burjil. I am now again in Germany. I am senior consultant of radiation oncology. My name is Hathal Haddad, and I will be the designated head of the interventional radiation oncology at the University Hospital in Tübingen in the south of Germany from January. And this is the work that we did in Bonn, Germany before my move to Burjil. So I'm not now in Burjil. I'm also an active JEC Estro member. The goal of our work um, the goal of our work is the clinical evaluation of the using of the deep learning auto contouring, especially for the treatment of the primary and secondary liver cancers with single fraction HDR brachytherapy, and the importance of the using the artificial intelligence increased in the last years, not only in the diagnostic and the radiology, but also in the radiation oncology, especially in the auto contouring, auto segmentation, and also auto planning, which lead to the reduction of the timing consuming. You can see here on the right side is our the applicators inserted in the liver, and in the middle the ISO doses of the brachytherapy, and on the left side the auto contouring segmentation that we use from the company. Before I talking to you about the importance of the brachytherapy, I want to talk about the clinical evidence. The ESMO published and advised brachytherapy as one of the treatment modalities for HCC, and plus the SPRT and other modalities. And the brachytherapy working group in Cyprus, they also published last year their meta-analysis about using the brachytherapy in the treatment, not only in the primary liver cancers, but also in the secondary liver cancers. And they have show all the publications that published in the last years with many local controls and the overall survival. I would like to present also we did it last year and published it in the Journal of Personalized Medicine. This is the long-term comparative study between the primary and secondary liver malignancies, between the brachytherapy and the other ablative modalities in more than 200 liver lesions in 155 patients. And here it shows that the brachytherapy is not inferior in comparison with other modalities. And in our method, we use that 25 patients with 37 liver lesions, primary and secondary liver lesions, and the treatment was with single fraction HDR brachytherapy for liver tumor. And the implantation of the catheter was under sedation, under guidance of the CT. And we did a planning CT with thin slices, 1.5 millimeter with contrast media. The contouring was done by experienced radiation oncology and with the software from the company Olympus AI. And we used two computers, one with normal CPU unit and the other with graphic processing unit, which gives us a high quality of the measurements of the anatomical regions. And our GTV was done on the MRI and CT, and we didn't give any margins to the PTV. And in the auto contouring was the liver, the kidneys, the stomach, intestine, heart, esophagus, and lungs. And what we found that most of the cases, more than 60% was the metastasis from colorectal cancer, and at the second position was more than 19% from the breast cancer. And also we treated in our study primary liver cancers like HCC and CCC. The mean target volume was about 50 cubic centimeter, and we use in the mean 4 catheters. We used 25 gray for the colorectal metastasis because it's aggressive tumor and need a lot of doses. But for the other metastasis, we use only 20 gray. And in the HCC, we use only 15 gray. And what we found, there is a statistically significant reduction in the time between the human, or in this case, the experienced radiation oncology, which he needs 17 minutes for the contouring of the GTV and the whole organ at risk. And between the two computers, the normal computer with CPU, it take up 3 minutes, and the graphic unit, it needs only 2.2 minutes. So there was a very significant reduction in time. And we needed the stomach as organ at risk in 21 cases, and the right kidney was necessary for 26 cases, and the intestine, we did it in 33 liver cancers. So this shows that the using of AI reduced the time. This is one of the cases that we use it. This is a case of HCC. It's 73 male with previous surgery for HCC. So he got developed and recurrence disease after years. And so the operation was not necessary. The pictures you see with the above was the tumor before the therapy, which was big tumor, 8 centimeter. And after 9 months of doing the brachytherapy, the tumor size reduced to 3 centimeter. There was completely necrotic, and there was no signs of vital tumors. So this is one of the cases that we can advise to do it for the HCC, for example. It's safe and very good modalities to do it. So my take-home message for you, single fraction of HDR brachytherapy for liver cancers is safe and effective and gives us a good local control. And the application of the artificial intelligence, especially for the auto segmentations, it can reduce the time of the contouring more than 15 minutes. It depends on the experience of the radiation oncologist. With the resident doctors, it takes almost 45 minutes or even 1 hour, and this will reduce the unpleasant lying time for with the applicators for the patients, and in this case reduce the risk of bleeding since the applicators in the liver. And here, this is my last slide. Thank you so much for the invitation and be here with you, and wish you a beautiful, pleasant Mistro course.